Good evening, my social media family. This is your favorite chiropractor, Dr. Lee Lister. I want to talk to you today about chiropractic. I want to tell you exactly what I do here in my office and exactly what chiropractic is. A lot of you guys have questions about chiropractic. You want to know what's going on, what we're doing. Well, here it is, and here's how it happens. So, when you think about chiropractors, what we are spine specialists. We focus on the spine as the root cause of what's going on with your health. In your spine, when you look at the spine, we really don't think about our spine until something happens to it. But the spine has two main functions. The first is to keep you upright, which makes sense, right? The second function of the spine, and the most important, is protection of your spinal cord. Your spinal cord is housed within your spine. Your spinal cord is essential for the overall health and the well-being of your body. Let me show you what I mean by that. We don't think about our spinal cord, but it works for us even when we don't think about it. So let me show you how that works. So this picture right here is exactly how your body works. This is your nervous system or your electrical system of your body, right? And when you look at this picture right here, what do you think is the most important organ in your body that controls every single function? I'm going to wait I'm not going to let you wait. It's the brain. The brain is the most important organ in your body. It controls every single function. So your heart can't beat, your lungs can't breathe, your stomach can't digest, your legs can't move, your arms can't move. Nothing can work unless the brain tells it what to do. But how does the brain communicate with every area of your body? It doesn't just magically appear. There's a communication pattern that has to happen with the brain sending information out to your body. Let me show you how that works. And so the brain sends all the information down the spinal cord like a river. You have branches of nerves that come off of the spinal cord that come through the spine, through the bone, which is very important for chiropractors, and they're attached to every organ, every muscle, every cell, every tissue in your body. So the only way things work in your body is receiving information from the brain, spinal cord, and the nerves. So if there's a blockage anywhere down and out, then the end result is going to be pain, dysfunction, and if left untreated for so long, it could lead to disease. And so let me show you what's so important about the nervous system and how it works and what we do as chiropractors. So let's backtrack a little bit. We know if we get a brain injury, that's pretty significant, right? We know if we get a spinal cord injury, we know that to be pretty significant, right? We've heard about these things. But what if we get a nerve injury or a nerve interruption or lack of flow of the nerves? That can be significant as well. It may not be as systemic initially as the brain or spinal cord injury, but it's significant in that something's going to suffer because of that lack of nerve flow or that interrupted nerve flow. Let me show you how that works. So, if I cut that nerve right here to the heart, and that brain tells that heart what to do. If I cut that nerve to the heart, what do you think happens to that heart? It stops completely, right? Exactly. Now, what if, because you're supposed to get out 100% of information from that brain to that organ, muscle, whatever it is. So what if I squeeze that nerve now, and you're only getting out 50% of information? The heart is still working, but is it sick or is it healthy? It's sick, exactly. Same thing can happen here in your lower back. These nerves right here are going out to your lower back, going out to your legs, down to your feet, running through your sciatic nerve. If these nerves are choked off due to, I'm going to show you exactly how that happens, but due to a bone being in the wrong position, if they're choked off, you're going to have back pain, pain shooting down your legs all the way down to your feet. If the nerves are choked off here in your neck, you can get migraines, you can get sinusitis, you can get neck pain, you can get pain shooting down your arms, down to your hands and numbness and tingling. And so our job as chiropractors is to restore the flow of the nerves and allow your body to help heal and help heal itself. And people always ask me, well, doc, how does the body heal itself? How can the body heal itself? Well, when you get a cut on your hand, what heals the cut on your hand? Does the Neosporin heal the cut? Does the Band-Aid heal the cut? No. Your body heals the cut. Your body is always working itself to bring itself back to homeostasis. It's always trying to self-heal itself. And so my job as a chiropractor is to put your body in the best position in order for your body to win, in order for you to feel good, in order for you to get out of pain, in order for your body to function better. And so again, if those nerves are choked off, there's parts of your body that are suffering as well. Now here's the big thing. People say, well, doc, how do you know that I have an issue? How do you know if I have a healthy spine? There's a few things that I check. First, I want to make sure that you have a curve in your neck, a curve in the mid-back, and a curve in your lower back. If you don't have those three major curves, I know that you don't have a healthy spine. If your spine is not straight up and down from the front, if you have any lateral curvatures, I know that you don't have a healthy spine. Now, there are some people that have a structural scoliosis that are born that way, and we can get them some minor correction. We can get them a lot of comfort through the adjustments and through chiropractic. But most people have what we call a functional scoliosis, and that means that over time their spines have shifted due to life, sleeping on bad mattresses, accidents over time, falling off the monkey bars, or different things. My job as a chiropractor is to, number one, look at your spine and to see that you have a healthy spine. Now, that's more on a macro level. On a micro level, every vertebrae has a nerve that comes out of it. Every vertebrae moves. So as your vertebrae move, as you bend forward, as you bend backwards, as you rotate, your vertebrae are always moving. Sometimes they get stuck in the wrong place and they don't go back. And so we call that a subluxation. So that subluxation is that vertebrae moved in the wrong position. Now remember, you have a nerve coming out of every vertebrae that's going to a place. So if that vertebrae is moved on top of that nerve, meaning that that nerve is now shut down, wherever that nerve is leading to, there's going to be an interruption of flow, and dysfunction, pain can happen at that point. Let me show you kind of how that works. So I have a lot of patients that come in with irritable bowel syndrome, right? Irritable bowel syndrome happens in the large intestine. So a lot of people come in and say, Doc, I have irritable bowel syndrome, I have IBS. Well, I know which organ that comes from. I know exactly which nerve supplies that organ. I know exactly what vertebrae that nerve comes out of. Let me go to that vertebrae and see if that vertebrae is out of position. And more than likely it is, because you've been eating the same food. You've been doing the same thing. Nothing has really changed over time. And so maybe your body has changed over time. And so maybe let's look at that vertebrae. If it's in the wrong position, I'm going to restore it by making the chiropractic adjustment to that vertebrae. Restore the flow of the nerve to that area, and the area is going to heal itself. That's what we do. Now, a lot of us, we go with the medicine route. We take a medicine, but typically the medicine just does what? It just masks the issue. It doesn't get down to the root cause of what's going on with you. My job as a chiropractor is to make sure I get down to the root cause of what's going on. Now, people say, well, is that 100%? Well, I tell everybody there's all kind of different things that can happen to you. But when you're dealing with the spine and the structure and the nervous system of your body, about 80% of what we go through happens because of structural changes in our spine, meaning that if your neck is this way or if your spine is this way, your body's going to suffer because of it. And it's my job as a chiropractor to put your body back in the right position, to help your body heal better, to help your body function better, so you can live a really great life and live the life you want to live and not the life that you have to live. That's it, folks. I hope you enjoyed the talk. I really enjoyed talking to you guys this evening. Have a great day, good golf, good tennis, or whatever makes you happy.